Buddy, come here. Come here, buddy. Bud. Come on. He's taking a nap. It's before work. Come here, buddy. Come on. Say hi.
We'll get it. We'll have him as a featured guest next time.
Okay. Yeah. You know, he actually helped me write a chapter on animal-assisted therapy for ADHD. That was published a couple of years ago, and he's also worked on newsletters talking about animal-assisted therapy.
Yeah, I would guess that an animal as part of the therapy would be quite helpful as a calming influence, right? Is that maybe that wasn't part of what we're going to talk about today, but it's kind of interesting. Why don't you share with us how that can, having a pet can help?
Well, there was a study actually that was done with preschoolers at University of California, Irvine, and what they looked at is they looked at patients that got behavior therapy. So the little guys, we're talking 4 and 5-year-olds getting behavior therapy. Their parents would get behavior therapy and help manage them, but the kids were also working with dogs and training them, and actually ADHD got better in the group that worked with the dogs.
Was that with medication or without medication as well? In combination with medication?
Without medication.
Really? Okay. Interesting.
Yeah, most medications are not approved in that 4 to 5-year-old age
group.
Right.
Because you looked at from age 6 to 17, right? So that would be below
well, we
that
looked
cutoff.
from 6 to 17, but most medications, especially extended release stimulants, are not approved for patients under 6. As a matter of fact, the only thing that's approved for patients under 6 is amphetamine immediate release, and that only reason that it is approved is because it was grandfathered in, so there really aren't studies with it.
For the younger children.
But the FDA doesn't like to approve long-acting stimulants for the little guys because we worry about growth.
Got it. One question I've been asking all of my guests is something about AI. I mean, you can't have a business conversation these days without bringing it up. And I thought I'd throw it in your, in your field over there to tell us what you're seeing. And I recently saw a paper on the use of, what was it? It was deep learning to accurately assess patients for ADHD. And I think they came up with a pretty good accuracy rate in the high 90% range. I don't know if you saw this study. I have the title here, but there've probably been a few done on this topic. If you want to comment on this study and you've seen it, please do, or perhaps just give us some other observations on, how AI is playing a role in the diagnosis and treatment of ADHD.
Well, they use machine learning to crunch data, so that's really important. AI isn't always accurate, so depending on where you get it. When I was preparing for this interview with you, and I was looking at different topics and punching them in, some things were spot on correct because I knew the data, and some things weren't quite as much. So you have to be just a little bit careful with AI. For example, one person who did a lot of studies for the CDC, her name was Melissa Danielson, and they had the first name wrong. They pulled up her name, but they had her wrong. So you have to be a little bit careful with AI. And AI can be a little bit scary because I just saw a study where people had higher incidences of psychosis when they were using AI to help them with their mental health issues.
I see. So you got to be careful, and it's probably best used in conjunction with a physician. That kind of brings up another topic about AI. I mean, it seems like it's a good assistive tool or perhaps a screening tool. I mean, does that make sense to you to perhaps use it as a screening tool?
You can use it as a screener. There are great screeners online. There's a thing called the ASRS version 1.1. It was developed by Lynn Adler, Tom Spencer, and Joe Biederman, the same folks that developed the adult investigator scale that we talked about. And it's real quick. It's 18 DSM items. You can go through and check them off if you think you might have ADHD and take it in when you see your provider. and they can go over it with you. I would never use a scale like a screener to diagnose ADHD, but what I would use it for is a jumping off point to talk about symptoms and to talk about history, because you have to have a history to be able to diagnose ADHD. Even though more people are diagnosed as adults, you have to have at least some symptoms before age 12 to meet the diagnosis. You may not have had all of the symptoms to qualify for the diagnosis at age 12, but you need to have at least some symptoms.
Okay. And Dr. Childress, I want to thank you for being here today. As we talked about earlier, you presented at the AACAP conference in Chicago. Are there any last comments you'd like to make on the AACAP conference or CTX 1301 as we wrap it up?
Well, all I can say is AACAP is always a great conference. Learn a lot of new stuff about what's going on in the world of child and adolescent psychiatry. So if people have never been, they need to come next year.
Sounds good. All right. Well, please thank our guest, Dr. Ann Childress, president of the Center for Psychiatry and Behavioral Medicine, and also the principal investigator on the CTX 1301 trials. We appreciate having you here today with us.